Let's bring in Mississippi Republican Governor Tate Reeves. Governor Reeves, thanks for being here. You just heard Governor Kelly from Texas. Your thoughts, what are you doing?
Well, Brett, thanks for having me on today. And one of the things that I was glad to hear my colleagues say is that one size does not fit all. It's why those that are clamoring for a national strategy do not realize what those of us as governors that are in the trenches that are working every single day. What's best for Kansas today is not necessarily what's best for Mississippi. And in fact, I've got 82 counties in my great state, and what's best in the northeast part of our state, where numbers are in a certain spot, versus what's best for the Mississippi Gulf Coast, are different. And that's why we are taking a county by county approach. We began this dating all the way back to late June, early July. And we have an objective criteria in place in which if any county has more than 200 cases over a 2-week period, or more than 500 cases per 100,000 residents, then we put additional measures in place, more strict measures in place, which may or may not include a mask mandate. It certainly includes having smaller size gatherings and other things such as that. And so, again, it's very important that governors have autonomy to do what's best for their constituents. And when you talk about the notion of lockdowns, one of the reasons people are so concerned about that right now is because some of the leading experts that are advising the Biden administration are certainly suggesting that. And so we're going to push back against that as well. And I'm glad to hear that there are Republican and Democrat governors across the country that agree that that's not the right approach to take.
You know, Governor, you're seeing your hospitalization rates go up. You have a test positive rate in Mississippi, according to Johns Hopkins, at 18.8%. And that's a concerning number, but you're saying you're handling it different in different parts of the state.
Yeah, well, the reality is that we are seeing a slight uptick in cases. We are nowhere near where we were back during the summer months. If you'll recall, many of the Southeastern Conference states, Louisiana, Mississippi, Alabama, Florida, Georgia, had a very, very challenging summer. At that time, we actually had 1,250 hospitalizations at our peak. That was on July the 26th. Today, we have approximately 850, so we're somewhere in the neighborhood of 65 to 70% of total hospitalizations at our peak. We're very pleased that there are a number of good things that are coming out that are going to help us deal with this virus. The antibody opportunities that exist in terms of the therapeutics is a huge move in the right direction for us. I was talking to my state health officer about that earlier today. It's going to allow us to treat as many as 700 patients in the near term. In addition to that, the vaccine is just around the corner. And so what we all need to be talking about is how do we bridge the gap from where we find ourselves today, where we are seeing rising cases in our state and every other state around the nation. How do we bridge that gap from today to when we have more and more distribution of the 2 vaccines that have literally in the last couple of weeks been discussed?
You mentioned SEC football. That's a big deal down there. You had the Texas A&M Ole Miss game canceled. Do you think SEC is going to be able to finish the season?
Well, there's no doubt that we've had some challenges over the last several weeks. There's been a large number of games that have been canceled. And the reason for that is because we're seeing significant numbers increase in community transmission. As total numbers increase across our states, then obviously a larger number of those associated with the program, football players, et cetera, are testing positive as well, which is making challenges. So my plea to everyone in the Southeastern Conference, or everyone who cares about college football around the country or cares about sports in general, is the best way we can ensure that they go forward is by doing our part. Let's do the little things that make a difference. Let's wear a mask. Let's stay in small groups, even over Thanksgiving. Let's be personally responsible. We don't need the government to tell us what to do. We as individuals just need to recognize that we can do some little things that make a big difference.
Across party lines, Governor Reeves, we appreciate your time. Governor Kelly earlier from Kansas, thank you both for being on.